Hello, everyone. Thank you so much for joining us. My name is Jason Onesto, and I am the Assistant Director of New Student Programs here at the University of Richmond. I am joined with some representatives from the university here today, but before we get started, just wanted to go through a quick little housekeeping note. There will be time at the end of the webinar for you to ask questions for them to be answered by the reps that we have here today. However, if for some reason during the contents delivery you would like to go ahead and use the Q&A function at the bottom of your screen, please feel more than welcome to do that, and we'll be more than happy to get to your questions as soon as we get there. Without further ado, I'm going to hand things off to Dr. Lemon and then Dr. Ed Kesha to introduce themselves.
Great. Good evening. Nice to meet all of you virtually and welcome to the Spider family. I'm Dr. Latrina Lennon. I'm the Director and Medical Director of the Student Health Center. I'll let my counterpart introduce herself and then I'll start off with some Student Health Center information first.
Thank you so much, Dr. Lemon. Hello, everyone. Welcome to tonight's webinar. I am Kesha Trim, and I'm the Senior Director of Risk Management and Insurance for the university. So in that role, one of the things I'm responsible for is the coordination of our student health insurance plan, which I will tell you more about a little bit later.
Great. All right. I'm going to go ahead and get my PowerPoint up. Let's see. Share. Here. Oh, there we go. Okay, hopefully everyone can see that. Kesha, can I get a thumbs up? Are we good? Okay, great. Thank you. So again, welcome everyone. I'm going to give a brief overview of the Student Health Center. Most of this information is on our website as well. And during the summer, although we are not open for appointments, we are available for administrative questions and of course, clearing vaccine records for all the incoming students. So if you do have questions that we don't address tonight, feel free to call the Student Health Center. Also, you can email non-medical information to the Student Health Center as well, and we'll talk about that contact information later. So what is the Student Health Center? So we are a medical clinic that focuses on primary care. We're located on campus in the Wellbeing Center. Our staff includes 2 board-certified physicians, myself, and also the assistant medical director. We have 2 nurse practitioners who are board-certified in family medicine, 3 registered nurses, including a nursing supervisor, and certified medical assistants. We also have a front desk operations staff as well. We typically focus on acute illness and injury for students, although we are very capable of managing chronic conditions as well. And we'll talk a little bit more about that later on. We also will help with vaccines for students, obviously clearing immunization records for incoming students. And we will do some preventive health care. We can do physical exams, and I'll talk about some more of our services later on related to that. We are an accredited ambulatory care center by AAAHC. That's every 3-year accreditation cycle. So typically when you're looking outside of a major health system, like maybe your own primary care doctor's office, a lot of them are accredited by this organization. So it's very rigorous standards that we maintain in the Student Health Center. We also offer point of care testing. That means lab tests that we perform in the clinic, such as like strep testing. We can also do some urine testing to screen for urinary tract infections as well. And finally, we are able to draw blood work, so perform phlebotomy services, but that's only for an order by a provider in Student Health Center. Because of how we are managed, we don't bill insurance, which we'll talk about later on. We are only able to do lab work ordered by one of our providers. So if a student has a chronic health condition for which they need lab monitoring, oftentimes students will have their home provider coordinate with our office. We will see the student first, meaning myself or one of the nurse practitioners or other physician. We will then determine the labs that we're able to perform in the clinic and then perform those lab services with the results routed back to the primary care provider. So it does become a convenient option for students on campus. As far as where we're located, many of you may have seen if you toured the campus previously, we're in the beautiful Wellbeing Center on campus, located closer to Robins Stadium as well. We're located on the 2nd floor of the Wellbeing Center, so we are co-located with our colleagues in the Counseling Center who are 1 floor above us. And on the bottom floor of that Wellbeing Center is where the Flavor Cafe is. We also have our facility and therapy dog, Carla, who's also in that location as well. A little bit of information as far as how do you make an appointment, fees, and things like that. We are an appointment-based clinic. So we do offer same-day availability, but having an appointment ensures we have time to appropriately address your concern, perform lab work, administer vaccinations, and things like that. And that appointment is typically with one of the physicians or nurse practitioners. We do have registered nurses that perform triage, and they do typically triage and assess some of our students who may be same-day appointments or walk-in, and then route them to a provider as needed for a follow-up appointment, or some things our registered nurses are able to triage and then disposition the student directly. We do charge a fee for certain services. So there's never a fee to see the provider in the clinic or to see the registered nurse. But we do charge a fee for lab services and also for immunizations. We always discuss and declare those charges for the fees for the immunizations and medications and things like that at the time of service. So you are very aware of what we do charge. We utilize LabCorp as our reference lab. So we only do point of care testings, like things that can be done in the primary care office. Anything that's a blood draw, or if it requires further testing, like a urine culture, wound culture, we send those out every day to LabCorp. LabCorp has a contracted rate with Student Health Center for the labs that we perform. And then that charge for those labs is applied to your bursar's office account with the university. So you never pay anything at the time of service for labs or vaccines. It's your bursar's office account that you would then pay those charges for directly to the student health or the student campus bursar's office. We are not able to bill your medical insurance because the majority of our students are out of state, and we also have international students. We are not paneled providers with all of those various insurance companies that exist. So the way we remedy that is that we bill your bursar's office account, and then you or your parent or guardian, whoever pays the charges for the university, can then pay directly to the bursar's office. There is a way to submit that to your insurance company for reimbursement. Kesha will talk a little bit about that, but also the Student Health Center can help point you in the direction of the individuals who can help you with that, but we do not bill your insurance directly. We are still in the process of setting up a medication dispensary on campus that'll be at the Student Health Center. So if you've ever visited an urgent care center, you may be familiar with, you're prescribed a medication that you are then receive at the urgent care center to take home and start your treatment plan. We'll be set up similar to that. We will not have outside prescriptions we can accept. That's not something that we are able to do per the Virginia Board of Pharmacy regulations. But for students who are seen at Student Health Center by a Student Health Center provider for certain medications like commonly prescribed antibiotics, you'll be able to, if you choose, be able to have your medication dispensed directly from the Student Health Center. And the charge for that medication will also go to your bursar's office account. This will be a limited supply of medications and typically not medications for chronic conditions. As we get ready to roll that out, we're anticipating it this upcoming fall. There'll be more information sent out about how that service works for the medication dispensing. There are several pharmacies close to campus because students, by their choice or due to their insurance specifications, want to utilize their medical insurance to fill prescriptions. So we can send a prescription electronically to any pharmacy of your choosing within the Commonwealth of Virginia to be able to get that picked up. And there's several, a few that are within walking distance to campus, and also several that are serviced by the off-campus shuttle as well. So oftentimes we get asked, what do you do when the clinic is closed? So we're open during the academic year. We're open Monday through Friday from 8:30 to 4:30. We do have some administrative meetings that are every Thursday morning. So we open at 10 o'clock on Thursdays. So if the clinic is closed, whether it be a holiday or break, we do have a nurse triage service available 24/7 when the clinic is closed. And that's actually active right now that the Student Health Center is closed in the summer. So to access that, and again, this information will be presented at orientation. It's available on our website, and we'll review it again. Should you choose to see us at some point once you arrive on campus, you call the main clinic number and you press the option to be connected to the after hours nurse service. A registered nurse will give you a call back and they will be able to triage your concerns. They cannot make appointments or prescribe medications, but they are familiar with local urgent care centers or emergency rooms should you need that level of care. We always remind students and obviously visitors to campus, if it's a true medical emergency, we want you to call URPD and they will come out to your location, and UREMS, if the students are here on campus at that time, will also arrive and they will dispatch appropriate local ambulance services as needed. There are several urgent care options in the area as well. So if it is something where you know that you're going to need evaluation and treatment on a weekend or after hours, there are several urgent care options that are available by campus shuttle and also by an Uber or Lyft should you need to go there after hours. A lot of students we know arrive to campus managing a chronic health condition. So something that they're either seeing a provider for routinely or on chronic medications for. So we always want to talk a little bit about, well, how do I do that once I get to college? For most of our students, they are away from home by hours, if not a flight or more. So we always want to make students aware that Student Health Center is available. We are able to work with your home provider depending on the treatment plan. There may be things that we're able to provide services for in the clinic, or we can ensure that you get connected with appropriate specialists in the community. One of the great things about the city of Richmond is that it's home to many various high-level specialty tertiary care centers. So if you need to see a specialist for ongoing care, we can definitely give you that information. And of course, checking with your insurance company to make sure they're in network. There are other campus partners that we work with as well, including disability services for students who may need accommodations, the counseling and psychological services, which is where the campus psychiatry providers have their appointments in CAPS, and then also the campus dietitians for students that we know who may have concerns related to nutrition, certain diets that they need to maintain. The campus dietitians are a wonderful resource for that. We do recommend now is the time to have that meeting with your home healthcare provider to make a plan for when you transition to college. We want to help to set you up for success. So whether that's, planning now a schedule to see your home provider during breaks, or if you need to get transitioned to a specialist here locally, you can contact us, you can email us, you can call. Like I mentioned, we are available for administrative needs in the summer to find out local specialists so you can make that connection to make sure that your care is consistent while you're here away from home at school. The most important thing, which I know many of you are eager to hear about, are the pre-entrance health forms. These forms are required by the university, and the University of Richmond has adopted forms that are consistent across the Commonwealth of Virginia per the law of Virginia. So even though we are a private institution, our university has fallen in line with other state institutions in Virginia and really consistent nationally with what's required for incoming students as far as vaccinations and other health screenings. So if you have not already, we do encourage you to access your student health portal, and I'll show you the website for that shortly, where you can use your single sign-on, which you can get that information from the campus IT department if you don't have it already, and then you can log in and complete your pre-entrance health forms. There'll be information where you will need to document 5 required vaccines that you see here listed: tetanus, MMR, which is measles, mumps, rubella, polio, meningitis, ACWI, which is different than meningitis B, and hepatitis B. There are waivers available for 3 of those vaccines, and that information is on the student health portal should you choose to complete the waiver. If you're under 18, your parent or guardian will need to do that. And you will also need to upload a copy of your vaccination record. So we need you to enter the information and to upload the record, because we do cross-check every vaccine record that's entered. Along with that, there are also a tuberculosis screening form, which again is a health form that's required by many, many institutions across the country to screen for tuberculosis, which is a respiratory condition that is contagious. And then also we want you to complete a medical history form, which allows us to help connect you with resources should you choose to have us help you navigate that process. Please note the deadlines here. For those students entering in the fall, July 15th is the deadline that the university has set by which we want those forms completed. If you are not able to complete the forms by that deadline, please note that there is a process that follows the code or law of Virginia, where your next semester, which will be spring of 2026, there would be a registration hold placed if you have not completed those forms completely. So we do communicate with students, because some students have to send things in pieces. They may need to follow up with their provider. They may be missing a vaccine. We actively communicate and constantly communicate with students. As you send us stuff, we're reviewing it within 24 to 48 business hours, and then we will respond back to you through your portal and send you a secure message on items that are missing. This is a copy of the paper immunization form. So for some individuals, they may say, oh, I'm coming up to see my pediatrician, family practice, primary care provider this summer for my routine physical, or hey, I'm going to make an appointment with them because I know I'm going to be starting college. If it's easier for your home provider to fill out this paper form, that's fine. You then need to submit that through your student health portal. Your provider cannot submit it. It has to be submitted through the student health portal, because that is how we securely receive the information. Many providers will just print out a copy of your vaccine record. It's very easy for them to do. So just make sure to ask for that information if you don't have it already. And again, keep in mind the required vaccines. There's some that are recommended. We do encourage the full panel on the page, but the required ones are absolutely needed for to be in compliance for University of Richmond. So how do you access the Student Health Center website? So basically you can go to student health or healthcenter.richmond.edu. If you go to the main university webpage, you can click there and search for Student Health Center. It should pop up pretty easily to be able to locate. And then once you get to our homepage, it looks as it shows here. So Student Health Center homepage has a lot of information. It includes after hours resources. Like I mentioned, whenever the Student Health Center is closed, it includes information on emergency services, how to access, your health information through your student health portal as well. The student health portal is a link on our homepage. So once you click on that link, it's going to take you to a screen like this where you want to make sure that you are selecting University of Richmond. We use Medicat as our student health portal. It is a common electronic health record system used by many, many college campuses across the country. Once you select University of Richmond and log in using your single sign-on, it'll take you to this home screen page. There's a lot of information here, and for incoming students, there'll be only a little bit of information filled out. So immunizations is the main area that you're going to be focusing on right now, and then messages as they come in from the Student Health Center once we look at your information and determine if anything is missing. So just to kind of recap, as we get ready to close out this section, I did want to make sure that you're aware that Student Health Center is part of the campus's You Are Well. So really the comprehensive approach to well-being on campus. So I mentioned some of my campus partners. So Counseling and Psychological Services, also called CAPS, is part of You Are Well. Disability Services. We also have University Recreation, and we also have Health Promotion, along with an operations team. So altogether, those 6 departments or areas make up You Are Well or well-being for our students. We really take a comprehensive approach to caring for our students, and we're here to answer questions. If it's something where you're not sure which campus resource to talk to, if you're wondering if you need accommodations, Disability Services is eager to answer questions from you. You can reach out to them directly. If you reach out to us, we can help get you connected if you're not sure who to contact, but just don't hesitate. We want to make sure and provide you with as much information as we can as you get ready to start your college journey. As I mentioned before, we do have an email that you can utilize. We do strongly advise against sending medical information through email, so protected health information. Do not send vaccine records through email, nothing like that. That's for general questions like, hey, I can't get to my portal, things like that. So definitely utilize that. You can also get a lot of information from our website, which is healthcenter.richmond.edu. And finally, we do have the phone number. So even though we are not open for appointments in the summer, we are there every day, minus any university holidays or weekends, to be able to answer questions. So you can leave a message. Someone will give you a call back. If you have questions about, immunization requirements or things like that, we're here to help answer those questions. So on that note, I'm going to turn it back over to Kesha to talk more about the student health insurance plan.
Thank you so much, Latrina. Let me get myself situated here. Of course, this bar is in the way. Okay, thumbs up on the screen. Can you see? Alrighty, thank you so much. So I am here to talk to you a little bit about our student health insurance plan, also known as the SHIP, for the 2025-26 academic year. So first and foremost, why do we have our insurance requirements? So the university has a requirement that all degree-seeking traditional undergraduate students and law students must have health insurance. And the reason we do this is because there have been many cases over the years of a time where an unexpected sickness, illness, or injury has really caused a lot of undue hardship, either financially or, well, in addition to, just going through the process, but financial hardship to students, and that could upend their college career. So, what we do is we have our student health insurance plan that we have sourced through our insurance brokers, and we make that a requirement for every student. And so it's an opt-out type of situation for domestic students. So basically, what that means is that you are automatically listed as needing to be enrolled in the student health insurance plan or the SHIP. And every academic year, you must let us know that you have other health insurance that meets our requirements so that you can opt out of purchasing the student health insurance plan. Now, if you are an international student, you are automatically enrolled in the SHIP by the Office of International Education, and it's a condition of your enrollment. There are some limited exceptions to purchasing the SHIP for international students, which include if you have coverage through a parent, a spouse, or guardian's U.S. based employer plan. That's one of the ways you can opt out of purchasing the SHIP. But if you have insurance through your home country, then that will not allow you to waive out of purchasing the SHIP. For domestic students, there is a period that we call open enrollment. And what that means is that that is the opportunity for you to go online and either confirm your enrollment in the SHIP or go online and say you have proof of other insurance, you don't need the SHIP, and you waive out of it. We are currently in the process of updating our student health insurance website. So the SHIP site will open June 1st, 2025. That's the earliest you can go in and begin your waiver process or confirm enrollment. And then you have all the way until September 15th. It says September 15th, 2026, and I realize that that's a typo. You have until September 15th, 2025 to waive. So you have 4.5 months to go in and actually confirm or waive the coverage. After that point, you must have a qualifying life event to enroll in the plan. A lot of times, the way we see this is if a parent changes their job and so they no longer have insurance through their current employer, then that's a qualifying life event. You have lost your coverage. You can then enroll in the plan. Also, if you've aged out of your parent's plan, which may not apply to a lot of you on this call, but we have some graduate students who turn 26 and they can no longer be insured under their parents' plan. So then that's a qualifying life event. One important thing to note is that students who did not take action by the deadline will be automatically enrolled in the plan in late September. So again, I say if you plan to enroll in the plan in the SHIP for the year, then you need to just go ahead and go online and certify. And we'll talk about the timeline a little bit more on the next slide. So here is the SHIP timeline. As I mentioned before, the open enrollment waiver period begins on June 1st. If you waive between June and July 1st, you'll never see a charge on your account because in July, that's when the bursar's office puts the SHIP fees onto your student account. So you have until September, but if you don't waive before July 1st, you may see a charge on your account for the fall semester's coverage. And then you can waive, and then that charge is removed within 5 days of you waiving the SHIP. The policy starts August 1st, and although you have until September 15th to certify that you want to be enrolled in the plan, I always tell students who plan to enroll to go ahead and do it early so that as of August 1st, you have your insurance information. You can go get any treatment or all those immunizations and things that Dr. Lemon mentioned that you need as an incoming student. You can get those things done. If you wait until September and you're automatically enrolled by the university, then that's a whole 2 months nearly that you've lost out on being able to get treatment. You can always go back and file claims for reimbursement, but why do that when you can just proactively register for the plan? So that's just my little tidbit there, my little soapbox. So then you have coverage after as of August 1st, and then you'll notice that in December, if you're enrolled in the SHIP, you'll see the charge for the spring semester in December on your tuition bill. And this is important to note. If you submit proof of health insurance after the waiver deadline, you may only be eligible for a partial refund. So if you have other coverage, go ahead, get the documents done or submit it so that you can get that charge waived and you won't be in jeopardy of spending money that is unnecessary. Um, and also, you get weekly reminders to go in and waive. So if you want to stop the weekly reminders, go ahead and do it. Don't wait too long. So, an overview of our ship. The insurance company is United Healthcare, which is, a nationally known and recognized company. We are under the preferred provider organization, which means there are tons of providers in the Richmond area and even in your home states that are under the United Healthcare network. So this insurance is not just coverage for when you're here in Richmond. It also covers you when you travel back home for the summer or you go home on break. And if you need to see a provider, you can search for an in-network provider and have the coverage there. These dates are accurate. The coverage period is August 1st of 2025 through July 31st of 2026. Again, a lot of people don't realize that you have to go in and either waive or enroll every year. So for all 4 of your years at the university, you'll do this process. The annual cost of coverage is $2,526, and this is billed by semester. So if in the fall you'll see a charge for $1,263 and again a charge for $1,263 for spring coverage, and we just do that to make it simpler for everyone with billing purposes. And the rate applies to every student, spouse, and each child that's covered under the policy. Most of you won't have spouse or children, but if you do, then this is the amount they would pay as well. And if you have a spouse or dependents, you would pay the carrier directly for those spouse or dependents. So going over some of the benefits, Dr. Lemon mentioned all about the Student Health Center and the care that you can get on campus, but there may be times when you need care off campus. And so this policy, it is an ACA compliant policy. It provides preventive care, including immunizations, physicals, all your routine care, specialist care if you need to go to a hospital or have surgery. There's also the telehealth benefit that's available. And for students enrolled in the ship, you can have access to a telehealth doctor for no additional charge. There's also mental health care available through here, both inpatient and outpatient mental health treatment and telehealth mental health. There may be a charge for the telehealth counselors, but that would be listed in the benefits package. Prescription drugs, and then also travel assistance if you're traveling on vacation and you're more than 100 miles away from home or campus, then you can use this policy to get assistance if you have a medical emergency. So going over some of the financial components of the plan, we have deductibles, copays, and co-insurance under this policy. So the deductible starting there is the most or the amount you will pay for health services before the plan begins to pay. So for this year, it is $250 per person per year for in-network doctors. And you see there that for an out-of-network doctor, it's $600 per person per year. So you can already see that you get the most bang for your buck when you use in-network providers. And again, the United Healthcare preferred provider or network is pretty broad, so you should typically be able to find an in-network doctor. So after you pay your $250 deductible, you have what's called co-insurance. And then that's the amount that the insurance plan pays after the deductible has been met. So for in-network providers, the plan will pay 90% of the cost. You will pay 10% of the provider's charge. So say you go to not a dermatologist, or say you need lab work and it's $100. The plan will pay $90, you will pay $10, and that's after the deductible has been met. Out of network, of course, the percentages are lower there. Now, here's something that I want to highlight. So for preventive care, In network, no deductible applies. So all of your CDC recommended vaccinations or immunizations, any of your annual care, the 10 essential benefits like your annual physical, your well woman exam, those things are covered with no deductible if you get them off campus. Now, if you get treatment at the Student Health Center, no deductible applies there either. And so Dr. Lemon mentioned that they do not bill the student health or any insurance, and that is true. And so what you would do is you would take that bill that you received in your bursar account and you would file a claim through the United Healthcare portal for reimbursement, and they would reimburse you 100% for your treatment at the Student Health Center. Copays are the last financial piece of the plan, and these are just flat fees that you pay that are not subject to the deductible for different types of visits. So, for instance, if you need to go see an off campus physician, say a dermatologist or some other specialist, you will pay $25 for each physician office visit. If you need to go to an urgent care center, we have several around here, Patient First, Bon Secours, Concentra, and so forth. You would pay $50 for an urgent care center visit. And then lastly, if you need to go to the emergency room, you would pay $150. And these are just flat fees. And then any other services you would have would be subject to the deductible or co-insurance. For prescription drugs, we have a three-tier system, and you can see the copays here. These are flat amounts based on the type of prescription drug it is, either $10, $20, or $40, depending on the tier. And there's, if you have questions about a particular medication you're on our website, there's a link to the prescription handbook, and so you can see where your prescription or your medication falls in those three tiers. In the course of 1 year, the most you will ever pay out of pocket is $6,350 for individual coverage. And that's assuming you're using in-network providers. And so you don't have to worry that a catastrophic diagnosis or illness or condition is going to bankrupt you, or the sky is going to be the limit on the amount that you'll have to owe. Once you've paid $6,350 out of pocket, your obligation ceases and the insurance company pays the rest. And again, another plug for using in-network, you see that there is no maximum for out-of-network providers. So again, in-network is your best bet. Our insurance plan is medical insurance. It does not provide dental or vision insurance. And we get a lot of questions about, well, what if I need to see a dentist just to, have an annual teeth cleaning? Or I need glasses and I need my annual vision exam. Well, we offer voluntary dental and vision. Now, this is not managed by the university, so you will not see these costs paid on your student account or through the university. What you would do is you would go to this rcmndstudentbenefits.com website /University of Richmond, and there would be links to these plans that you could then go in and plug in your information and get information about the different plans available and select one and pay the provider directly. So going into some resources, this is the Student Health Insurance website. You see the web address down at the bottom is studenthealthinsurance.richmond.edu, but we also have a truncated version as ship.richmond.edu. It's a lot easier to type in. So what we have on our website, if you have questions about, okay, well, I know you told me there were some ways I could opt out of the coverage as an international student. What are they? So we have our insurance requirements by population, whether you're a domestic student or an international student. You can always see the most current rates. Again, the website is in the process of being updated, so check June 1st. You can see benefit highlights, just a brief summary of what's covered. We also have FAQs that we get a lot of times about a variety of things. It could be anything from how much am I going to be charged on my bursar account? When do they charge? What does this hold? Who should I call? What if I'm traveling abroad? What does that mean for my student health insurance? So just a variety of FAQs that we have collected over the year. And then we have campus resources. And so under the campus resources tab, you'll actually see links to the Student Health Center, to CAPS, because first and foremost, before going off campus for treatment, you want to see what we have here because it's already included in your tuition. So you don't have to pay, except for minor or certain circumstances, you don't have to pay too much. So you want to start at on campus. So we want to point you in the direction of that. And then of course we have the links to waive or enroll and the timing around that as well. Another site that you will interact with and can go to directly, we also have links to this site from our SHIP website, is rcmdstudentbenefits.com. RCM&D is our insurance broker that helped us find and source this insurance policy. And so this is where, so they also have a site where they have information about the plan. You can find doctors, just additional links. And so a lot of the links on our University of Richmond SHIP website point to links or pages on the RCM&D website. And this is my last slide. And so these are just some contacts and just general information. So I have introduced myself as Kesha Trim. I work in the U of R Office of Risk Management. And so I am your on-campus resource. So if you have questions about just in general the insurance requirement, or if you want to, if you say that you waived and you are not seeing that the charge has been removed from your account, or if you even wonder, well, I can't enroll in the plan, what's going on? Any of those types of questions, you can feel free to reach out to me and I will dig a little deeper and figure out how to help you. Tim Cummins is from RCM&D and he is our insurance administrator. So he can answer waiver questions. He also handles enrollment. He does the exceptions for international students and he can provide specific claim assistance. So if you have a bill that you've gotten and you just don't understand what is going on, you can give Tim permission to look into your situation and he will dig a little deeper for you. And so he is also another resource that people go to directly. And then lastly, United Healthcare. They're just general customer service. If you have specific questions about whether or not a treatment or service is covered, or you have an upcoming procedure and you want to know more about it or get an estimate of how much it's going to cost, they're going to be your best bet about the specifics with the policy. And then there are certain benefits that require pre-authorization. So you want to start with United Healthcare on that. So that's all I have. And so I'll stop sharing and turn it back over to Jason.
Thank you so much, Kesha, and thank you, Dr. Lemon, as well. Now is a time, everyone who is in attendance, for you to ask any questions that you may have, either about the information that Dr. Lemon shared, everything that that Kesha just shared, or really any other questions that you might have regarding coming to the university. We'll hang on for a few minutes, watch for the questions to roll in, and we'll see what happens. All right, there's one. We have a question saying, are there specific documents we need to request from our health insurance for the waiver?
So the health insurance waiver form will ask specific questions. I think you will need a copy of your health insurance plan information. So you need to know the carrier, you need to know the group number, the policy number, and so forth. And typically that's going to be on your insurance ID card, or you can get a coverage certification. You may or may not have to upload it, depending on what type of student you are and the waiver that you get. We have different waivers for different populations, but yes, that's all you should need.
Jason, while we're waiting for additional questions to come in, I thought of one thing I wanted to mention as well. I talked a little bit about the hold that's placed on student accounts by the Student Health Center. That's specifically for students who are not meeting the immunization requirements or the tuberculosis form or medical history form. That hold is applied once you get ready to register for the next semester. So we have the July 15th in place so that we have time to review your records, because some students do wait closer to the deadline, which means that my staff are having a larger volume of forms to review. So as we get your forms in, we review and communicate that back with you. There are students that, for various circumstances, for instance, students who may just not be able to get in with their home provider to get updated vaccines before they get to campus, wait to see us at Student Health Center once they are on campus and we open for the fall semester. That is fine. Again, we encourage the July 15th deadline, but we know there's circumstances that pop up. You can always email us if you have questions about that, but the hold is placed, it's typically in November, and that's to prevent your registration for the spring semester. So please keep that in mind, because I know that can be an area of concern and a little bit of stress for students, but that's consistent with the law in Virginia of how institutions of higher learning manage the vaccine requirements.
Thank you, Dr. Lemon. I have not seen any more questions roll in. Oh, just one more. Look at that. You got me. You got me. I have a question saying, my daughter is an international student or will be this fall, so we don't need to do anything insurance related because it will be automatically charged to our account, right?
That is correct. As an international student, your daughter will automatically be enrolled in the SHIP.
There's another one. We have an HMO plan that is primarily local coverage in Pennsylvania, but offers coverage through an extended coverage network for college students. Do we need to provide any specific documentation of the extended network coverage with the waiver?
You shouldn't have to. You should. There's some also additional questions that ask, does your coverage cover you while in Richmond? And so you would answer affirmatively, yes, it does. And so that would let them know that your plan will provide the coverage in Richmond. So you shouldn't have to provide anything further. But if you do, or if you get held up in the waiver process, Tim Cummins would be the person to reach out to get that resolved.
All right, so I see the question popped up. Is the vaccination record the only form that needs to be provided by the healthcare provider? Yes, that is correct. The tuberculosis screening form is a question form for the student to answer about, like, country of birth, if you've lived in an environment where you've been exposed to tuberculosis. And then the medical history form is just the student's personal medical history. So the vaccination record is the information that will be needed from the home provider. Some states do allow individual, citizens of the state to be able to access the state registry for vaccine records. If, for instance, let's say the home provider has retired, you don't know how to get that information, you can check with your state health department. And for some states, they do allow the individual to access that or request a copy of that information.
We'll give a few more minutes for any remaining questions that we have. And while we're here, for everyone who is still attending this webinar, we do have each and every single one of our summer webinar videos posted on our YouTube page. So if for some reason you can't remember some information that was shared or need to revisit some things that were shared in this presentation, or maybe you want to see any of the other webinars that you may have missed up until this point, all of those will be located on our YouTube page, or New Spiders YouTube page. It's simple. I can put the link right here in the chat if you would like to see it. Otherwise, we'll be here. There's another question.
All right. So the question is, are there specific versions of the vaccines you require? Yes. So the best way to answer that, because it's a lot of individual details, is to check the health center website. When the student logs into the student health portal, it also lists, for instance, measles, mumps, rubella, you need 2 doses of that, and they have to be after your first birthday. So yes, there are specific formulations of some of the vaccines. That information is also on the paper form that's accessible on our website. And if you have additional questions, you can email Health Center to get clarification on that.
Okay. See a question, will the slides from this presentation be made available too? And yes, I can provide my slides to Jason for sending out to you all.
Yes, I can do the same.
And then we can send it out to you all shortly after we receive those presentations. Alrighty, everyone. I do unfortunately have to hop off to another webinar. If you are in this webinar and you're attending our disability services webinar shortly after this at 7 p.m. Eastern time, I will see you there in just a second. Otherwise, thank you so much for joining us. Thank you to our presenters that we've had here. We hope you have a wonderful rest of however much you have left in your day, and we look forward to seeing you this fall. Thank you, everyone.
Yes.
Thank you. Have a good
Thank
night.
you. Bye.